it's a question many parents and grandparents and caretakers wrestle with when children get sick.
Yes, on one hand, you hate to be the one freaking out all the time over a little bump on the road,
Yeah.
but on the other hand, you also don't want to be the one who didn't make the right call if that fever or cough or dehydration turns into a much bigger problem. We have holistic pharmacist and author Sherry Torkos here to tell us how to make the right call.
Yes.
Thanks for having me.
Absolutely, yes.
Yeah, so let's start off talking about fever, because I think that is a big worry for a lot of parents,
Scary.
especially first-time parents. You worry about it. Okay, so I do recommend using an ear thermometer. I think it's an easy way to check your child's temperature. Not all fevers need to be medicated. You want to use a cool compress, give your child lots of fluids. If they need something for comfort, you can give some acetaminophen or ibuprofen, but never give a child under 12 aspirin because of the risk of Reye's syndrome. And keep in mind that when your body is fighting a bug, it raises its temperature. Fever is how the body is responding to a potential invader, so you don't always need to treat that fever. So don't panic.
Don't panic.
Only if it's 104 or higher.
That's what I was going to ask you, 104 and higher, okay.
Or if your child is less than 3 months, even with a fever of 100, and an infant can be concerning, go see the doctor. Or if the fever is accompanied by neck, ear pain, or vomiting or diarrhea, then that's maybe when you would want to reach out to the pediatrician.
Yeah, that's some good advice. All right, stomach flu. I hate the
Yes.
stomach flu from every angle, but you have some tips here on what to do, because usually my kids just lay in bed and I try to keep them hydrated.
Yeah, and that is the key thing when a child has vomiting or diarrhea, and vomiting is so common, as is diarrhea. For children, by the time they're 5, even a healthy child will have 15 episodes of diarrhea. Okay, so with both vomiting and diarrhea, keep them rehydrated. An oral electrolyte solution such as Pedialyte can be helpful. Give that frequently and often. A bland diet, once the vomiting is stopped, the bananas, rice, crackers, bland foods are helpful. And then something that is fairly new that can be given to children as young as 1 year of age is this DiaRescue. And this actually contains bovine colostrum, along with egg solids, and it works with the body's own underlying processes to restore intestinal function, and has been found to resolve most cases of pediatric diarrhea within a day.
Wow.
So this is something I recommend parents keep on hand in
Even
the
while
medicine
they're
cabinet.
going through it, or do you
That's
wait for
right.
them to be done?
No, you can give this as soon as the diarrhea stops. And I also would recommend, if you're traveling to different countries, taking that with you, because if you go to Mexico or somewhere, you're eating different foods, different water, drinking water that might have different bacteria in it, you can encounter problems.
That's a pretty common problem
And this is not
for
a
adults,
drug.
too.
This is actually a food for special dietary use, so it's not a drug, it's not an antibiotic. This is the pediatric formula, but they also have adult formulas. And I've done some consulting work with Pantherix, the company that developed that. I find it absolutely fascinating as a pharmacist. You know, I have to say, a lot of people will go in the pharmacy and they'll look at other products like Imodium, and you really should not take something to stop diarrhea like that. You want to, the body's purging itself of a foreign bug.
Okay, really quickly before we go, the colds and coughs,
and
when do you
flu.
stay at home, when do you go to the doctor?
Okay, so again, some of the things you can do at home, honey for a cough is very helpful for children 1 year and above. Using vitamin C, echinacea, things like that to stimulate the immune system to help the body recover. If the symptoms persist beyond a week, other symptoms, fever, then you would want to call the doctor. And for rash, gentle cleansers and soaps and healthy oils are all helpful.
All right, thank you so much. Going to get through the cold and flu season a little bit better. Thank you so much. And for more information and tips on how to make that right call, you can visit her website. It is sherrytorkos.com. You can also find her on Facebook.